Yeah, it says it's. Kia ora koutou, and welcome to this session with Jess and myself talking about the first assignment for your primary healthcare paper in semester 2. I hope that you're all doing well. I hope you got to have a wee break between semesters and that you are feeling fresh and ready to go for this first assignment. So Jess, firstly, would you like to tell us a little bit about the assignment?
Morena, Katrina. Yes, I guess we'll talk through it in a little bit of depth over this next half hour or so. But anyway, you're welcome to all who are watching, and of course you can come back and tap into this many times because it's just here for you on Moodle. So this assignment is the focus is different from the ones you've done previously, in that the focus is really on community health or population health. So you're not going to be delving into a health topic around individual health like you did with that first assignment of the last paper, but it's much more about looking at health in the wider context, and particularly, as the assignment purpose states, it's about the community where you work. So You're going to be delving into data which tells you what are the kind of the positive things about the health of my community and what are some risk factors around things like determinants of health.
Right. And one of the questions that we often get around this community assignment is, hey, I work in more than one community. I work in one community that's quite low needs and then one that has higher needs. Which community do I choose, or do I write about both? You can choose. You choose to write about whichever community you think will be easier to apply to the assignment outline. So you just choose which community is most relevant to you in this assignment. So Jess, just before we get into the writing, can we remind everyone what are the supports that are available for academic writing?
Sure. Yes. So second paper. So you guys, a lot of you will have had some kind of experience of the other supports through the last paper. So it's a reminder about LSS. And if you want them to help you with a particular aspect of writing or understanding the assessment tasks or looking at a draft, to email them or call them proactively so they can put you down on in their work schedule to give you some help. And on Moodle, you're going to have the supplementary sheet, which is where is it on Moodle? Katrina, do you know where it's been put on Moodle?
Yeah, it will be in the assignment one tile. Right. So the supplementary sheet, it complements the course descriptor information, which is very succinct and very tight. The supplementary sheet sort of teases out a little bit more detail about what goes into each section, how you achieve each of the learning objectives for this assignment.
Thank you. So yeah, I think those are the main ones. Knowing all the backup from Whitireia and also what's on Moodle, this video and the supplementary sheet as well.
Right.
I know from last time some people struggled with their search strategy, so depending on what needs you find in your community, you might find that actually you really want some LSS support around your community of practice, around ethnicity or particular research that's relevant to your population. So there might be a little bit of a different focus this time.
Yeah, great. Hey, Sid, and just remembering that the library is also available when it comes to helping support your search strategy for your literature. Sometimes for some of these topics, there might not be a huge amount of literature available from the New Zealand context, but the librarians can support you to find some of that, seminal research, the stuff that's foundational to whatever your discussion might be about. But also they might be able to help you find international comparable sort of literature. So don't forget about the library being available too. Hey, just before we get into it, one thing that I also wanted to remind you about, let's have a look, was about creating an essay plan before you get started. So it's really, really useful, particularly in a bigger assignment like this, where there's a lot to cover, to map out a plan of your essay. So put it out under headings and then allocate the word count to each of those headings. You can put some bullet points underneath the headings so you know, okay, so within this part, these are the things I'm going to discuss. And it's another really good way of, once you've done some of your literature review, some of your literature search, you can add your articles to each of the sections, and it will demonstrate for you really visually, particularly if you're a visual learner, how much you are weighting the literature against different sections. Because for us as markers, we can go into it and go, oh wow, she supported that section really well with the literature, but this part down here has no literature support. So it's a really good way to make sure you're balancing the literature across your assignment. So the general rule of thumb is, one literature source for every 100 words, to give you a bit of an idea. So the supplementary sheet is fantastic because it gives you a word allocation. So for example, in part 1, it allocates 300 words. So we'd expect probably about 3 references to support that part. Hey, the final thing I wanted to talk about just before we start going through the assignment is we want to acknowledge and recognise that this is a really stressful time for some whānau at the moment who are either unwell with COVID, who are managing complications around work and childcare and school and things like that, or also people who are close contacts of people with COVID. These are unprecedented times for us. And so with that, we have an expectation that we will need to be fluid in how of our expectations of when assignments can come in and things like that. So just like when you're accessing LSS or Potama, just be mindful to come to us early. If you have kids home from school because there was a close contact in the class or something, let us know early so we can put supports in place and be able to map out when your due dates might be in the future. What would be detrimental to you in your study is if you try and hold it together and try to hold it together and then get to the point where your assignment's overdue, we're sort of emailing you and calling you and wondering what's going on, and it's too late to put those supports in place. So please come to us early because we have flexibility to be able to support you in however you need this year. And
that's so true. And guys, we know you can do it.
Totally.
Said, or a few people said actually at the end of the last treat was in the planning. And Katrina, I love the idea of just starting a draft with the headings being your assessment tasks. For example, that first assessment task will provide a summary of the community where you work, including population statistics and determinants of health. Write it down in a Word document, and then you can begin to link your literature underneath it, even just the publication titles and authors of that literature. So really, really good way to start your essay plan in that way.
Yeah, cool.
And I'm just going to say one thing before we leave him, because it is all about the planning actually.
Yeah.
And so this has got lots in it, this assignment. So you're going to have to be calm and just give yourself little tasks to do, work through the process of doing it. Supplementary sheet hopefully will really guide you in that, and so will the word limits. Now they are only a guide, but for example, summary 300 words. Well, you know that with your writing, you will maybe do 100 to 150 words per paragraph, for example, or you might do 100 words per sentence and you do 5 sentences per paragraph. So that tells you you're maybe going to do 3 paragraphs for that part 1. And paragraphs only have one topic. Right. So when you do that reading, you're going to go, this is an important topic. Oh yeah, it tells me that in my community, we have got our population stats so that we have got a very significantly skewed ethnicity or skewed around age population. So that's going to be a 1 paragraph. And it might be that we also have a determinant of health, which sticks out as being really important, either maybe really good or really lots of negative impacts. The discussion around the negative impacts or that determinant is maybe going to be another paragraph. And you might have another paragraph around another determinant of health, for example. So you can
Right.
just narrow one from the literature. You're not going to be able to cover everything. So
yeah,
think
that's
about
really
yeah.
that's really, really useful. And I think one thing that you've described, but we probably haven't articulated so well, is about the action words within
Yeah.
each of the assignment tasks. So do you want to talk a little bit about, let's just say for this first part 1, do you want to talk a bit about the action words? Because I find it really useful to highlight them, to make it really clear what is it that they're asking me to do in this assessment task.
Yeah. So sure. And there is also I think it's in the critical writing book, which is mentioned in the supplementary, also has a really good thing on understanding assessment tasks, because actually that's where you need to start. You've got to really know that you understand what the assessment tasks are asking you to do. So assignment part 1, the assessment task is provide a summary of the community where you work, including population stats and determinants of health. So the action word there is the summary.
Got it.
And the key concepts are going to be describing the community where you work, population statistics and determinants of health.
Great.
So the action is going to be around you getting the research that's going to describe your community where you work.
Yeah.
Another example of an action word, if we go to another, let's have a look. So we're going to have, this is part 2. So part 2 says, from your community summary, select 2 determinants of health and critically analyse how these determinants enhance or limit the health outcomes. So that's got a couple of action words in there. Can you pick them? Select 2 determinants of health. So select as your action word. Your determinants of health are your key concepts that you need to be doing the research on. Critically analyse, that's your action that you're going to be doing. So again, make sure you're clear about what that means to you. It often means that you're comparing and reflecting. And that's going to be against some literature that you find. And it's the critical analysis is about how they enhance or limit in your community. So again, you can pull it back to what's happening in your community around these 2 health determinants.
Great.
Is that helpful?
That's really helpful. And I know it might feel like we're jumping the gun a little bit here, but it was just really about reflecting that each of the wording of the assessment tasks is very purposeful. It has an action that we expect you to do. And so if you're mapping out your assignment or your essay, making sure you're really clear about within each assessment task what it is that we're asking you to do, and then that way you really can't go off track. Probably the temptation, and I know because I'm a student myself as well, the temptation I know is to get words down on paper, and you just sort of want to start and just feel like you're making progress and getting the words down on paper. But what so often happens, unless you're very, very familiar with the learning objectives and what they're asking of you, is that you go off on a tangent and then you do all this beautiful work and you don't want to lose it, but you realize you've gone off the tangent. So you try and come back in and it ends up blowing your word count out. And it can be really, lovely descriptive writing, can even be really well supported with evidence, but it's not answering the question that we're asking. And we can't grade you for beautiful writing that doesn't answer the question that we're asking.
Right. Yeah. So it is key for you to understand what the key words are in the assessment tasks and what it is, what research are you gathering on what topic. So you're going to be gathering research on your community, you're going to be gathering it on health determinants for that first part 1 of the assignment.
Right.
And that really narrows it in.
Sorry, Jess.
So that really can narrow your thinking in and make it much less anxiety provoking once you know that that's what you focus on. Cool.
Absolutely. And if you're a person that does little bits at a time, because you don't have the luxury of lots and lots of time, it can give you a really nice, concise way of saying, okay, today I'm going to write the first paragraph of part 1, and that feels like a manageable task. It's not dredging through masses of literature. It's just looking at the literature that supports that first point, so it makes it more manageable, little bite-sized pieces of work to be done.
Yeah. Yeah, some of you may work in areas that already have a community profile, so it might be a little bit out of date, but maybe you've already had a look at it and it'll start to describe your community. So that's the essence of part one, is that you're going to have to do a little bit of describing your community with relevant current data, such as from Stats New Zealand or the Ministry of Health or your local DHB or your local city council. So that's your description with that little bit of analysis around why it's important in your community. But hopefully some of you will have a community profile that you can have a look back at in your area as well.
And often local councils have got community profiles as well with really up-to-date data. So it's worth looking on your local council website as well. Hey, before we get too much into part one, I just want to jump back to the introduction so that we're doing it in order so we know that everything is covered. So here it says the introduction, this is on the supplementary sheet, is about 200 words. So what might I cover in an introduction, Jess?
Yes, and just so there is a little discrepancy between don't be fooled by the descriptor. There was an inadvertent approximately 700 words left for part one, but don't worry about that. Stick with the supplementary sheet because it's a little bit confusing to look at that. So we'll just stick to what's on the supplementary sheet.
Right.
Oh, introductions, yeah. Great. Well, I'm sure some of you guys have really got this under your belt from the last semester's work, but so in the descriptor, the purpose, like why are you doing this assignment, and the assessment tasks really help to inform your introduction. So you say why you're doing it. What is the purpose of it? And for this one, the purpose is pretty clear that you're working from a population health perspective, so you can understand your community and work from that perspective. So that you're going to be introducing your purpose, and then you're going to be letting your reader know what you've covered in your assignment. And again, just like last semester, using the assessment tasks to just kind of signpost what you've covered is really useful. So then your reader knows what to expect. They're like, oh, I'm reading this because I'm going to learn about, an urban community in Auckland, and I'm going to learn what it looks like and, what some of the populations at risk are, and I'm going to learn about a health issue that affects a population in that community, and there's going to be some reflection around nursing practice, something like that. But you can't really go far as long as you stick to the assessment tasks.
Perfect. And I can tell you, as a marker, I go through the introduction and make sure all of the assessment tasks are there because it highlights to me that you've understood the purpose of the assignment. So it's a nice, simple way of constructing your introduction. Okay.
And I know that there's probably a couple of you listening, and I've maybe made a comment in your previous assignment that, you've missed an assessment task in your intro, and I'm hoping that you've covered it in your body, and quite often you actually don't. Because it's somehow you've missed it in your thinking. So if you cover the assessment tasks in your intro, chances are you're going to cover them in the assignment as well. Perfect. Yeah.
That's great. Alrighty, so back to part one. Provide a summary of the community where you work, including population statistics and determinants of health. And like Jess was saying, the data for this statistics, usually comes from Statistics New Zealand, which hosts our census data. There's also the local councils that we were talking about. There's DHB area data. So those are the places that you're probably most likely to get local sort of community-based data. Of course, you'll have your data set as well. So if you work for Plunkett, you might be able to get some local community data about from BI dashboard. And if you're an external student, you may have a place where your area data is described, or it might just be within the DHB data.
And I know some of you may know that Katrina and I worked in the same area here in Wellington and Newtown. And so straight away, if I was one of you guys doing this assignment before I've even started, I'm thinking about my community, and I already know quite a bit about it because I've worked in it for a little bit of time. So I know that my community is, ethnically diverse. I know that it's also deprivation level diverse. I know that it's pretty urban. I know there's a migrant refugee population. I know that housing is rubbish as a general rule. So already I'm knowing I can start to describe my population and think about a determinant of health, such as housing, or it could be around support for migrant families. So already you have that knowledge in your head. So if you can just kind of sit and reflect on that, that can really help you start off with how you're going to describe your community.
Yeah, and like Jess was saying earlier, you're not going to be able to cover everything. You could probably do 2,000 words easily describing your community and analysing which determinants of health impact the community the most. So think, strategically when you're thinking about this. Like Jess said, there was lots of really good qualities about Newtown. They had great access to healthcare services and things like that. So I'm probably not going to talk about that. They had good access to public transport. So I probably wouldn't talk about that either, unless I was wanting to highlight that as a positive. If I was thinking about things that were most significant to that community of practice, it would be things like income. It would be things like housing, like Jess said. Those sorts of topics that it's going to be really easy to talk about, get data about, and have supporting evidence to support my discussion. So we can't cover everything. So think about what's most significant to that community of practice, and to who, to what population within that community of practice, because it can be quite different.
Yeah. So I feel that we're sort of along that pathway. Part one, I think you can nail it.
Yep.
And just remember, it's for you, about your community. So it should be a really empowering approach. You're going to learn more about what's going on and actually who is missing out in your community, maybe because of a particular determinant of health. And I'll just talk briefly, because I know Katrina and I both read a research paper recently about, it was English, and it was about, during COVID times, about mental health and support during COVID, and how it's rocketed up for new parents at home. And so, sometimes it's support that you're going to look at for a particular group of people, or, you've got a high birth, you've got a lot of first-time parents. So, that can be a population at risk of disparity as well that you might think about. It's not just around, income or ethnicity. It might be a age, thing, or a migration status or something like that as well.
Yeah, great. That's really useful. And another really useful point is on your supplementary sheet, it gives you some guides around where the literature might be found to support your writing. Because remember, we expect literature support for everything, even descriptions around community. We need it to be linked to evidence. So it says here, Statistics New Zealand topics, the World Health Organization, Ministry of Health, Wellchild Tamariki ora literature, the DHB reports, and local body reports. So those are the places that you might be able to source your data, but also provide support for the discussion you're having around your determinants of health.
And it's always great if you have got a really clear difference or a clear picture, just provide that little data snap which supports that. So, for example, if I was working in parts of Auckland, maybe South Auckland, and I look at my community and I know that it is like 70% of people who identify with the Pacific Island ethnicity. And so you can just provide that comparative data, because it really provides the evidence for your kind of analysis and reflection about what's special about your community. So just use a little bit of data carefully to show why you are stating what you're stating, why this is your analysis.
And like Jess says, I love comparative data. So you compare your population against New Zealand population data. So, for example, you might work in a population that is 65% Māori, and you assume that the reader knows, well, that's a really, it's a really Māori dominant population. However, if you compare it then against national data, which might be 25% Māori, you go, oh right, I get it. So this is a densely Māori populated community. So they're going to have different strengths and different potential risks to their health outcomes as well. So I love it when I see data being compared to the national average, because it highlights the significance of what you're trying to tell the reader.
Perfect. Yes. And that's an team. So we love analysis. Cool.
So part 2, from your community summary above, Select 2 determinants of health and critically analyse how these determinants enhance, make better, or limit, make worse the outcomes in your community. 900 words in total. Tell us about this section, Jess.
Yeah, so you've already begun to look at your determinants of health from your part A, and you already know from your own practice what it is that you want to drill into. So, and you want to make it so it's really relevant for your practice, something that you've noticed that you want to find out more about. And so make your determinants of health, they tie into your community. Like, it wouldn't be any good choosing a determinant of health which wasn't an issue in your community, for example. So yeah, choose your determinants of health. For all the key terms, just like for any assignment, if you're not sure about what they are, and even if you are sure about what they are, actually, define them at the start of your discussion. So, this is where you're going to link to MOH or WHO literature that speaks about determinants of health. So define your key term before you launch into whichever 2 you've chosen.
Absolutely.
Yeah.
Great.
Let's have a look. Yeah.
So you would define perhaps the determinants of health. So the determinants of health are I don't know, I'm just going to make this up, but they're the factors that impact health and well-being of Tamariki in my community of practice. They can either enhance or limit outcomes depending on how they influence the population of the community. And then you can reference the World Health Organization or the Ministry of Health if they've talked about determinants of health. And then you can say, for the purpose of, this, I have identified the determinants of housing and education or whatever they might be. And it's always good to tell us why you've chosen those. So to give us give you some backup as to why this is significant for your community of practice.
That's right. I was going to add to that. What was I going to add? It's gone from my head. Maybe it'll come back in when we stop talking about this topic. What was it? No, it's gone. It'll come back.
Yeah, that's no worries. So it says here to define and describe the determinants that you choose and use literature support. So this is where you're going to use your academic literature around the impact of poor housing, perhaps the impact around income and poverty in New Zealand. We could be talking around the impact of access to healthcare services. And I actually am really looking forward to reading this assignment because there is some really interesting research that's coming out around the impact of COVID with access. That article that we were just talking about around health visiting, that would be a really great one to support a discussion around, the limits to access within your community and how that's been compounded or made worse with the influence of the pandemic. So it should be a really interesting assignment for us to mark when you consider how, our circumstances have been made a little bit more difficult with the impact of the pandemic.
And I know what it was. It was about good old needs assessment.
Right.
So of course, the wider determinants of health are often the things that make a whanau, have complex or long-term needs. In your comprehensive needs assessment that you do, you're both assessing, individual kind of strengths and gaps, and you're doing those wider determinants of health, housing and income and support, environmental issues, that sort of thing. So sometimes you can get a little bit of a discussion around the reflection around the needs in your community because of this determinant of health. And so, we always love reading about needs assessment, especially reflected with against well-child practice, which comes into the next part as well. Yeah, so right. The determinants of health are all about needs assessment.
Yeah. So just that final point for this section, provide an example from your community that shows critical reflection, linking what you observe in practice to what's reported in the literature. So this critical part or critique, this is quite an advanced writing skill. So it's about what does the literature say about this? And does that marry up with what I see in my practice? Now, in our paper, you're allowed to talk about your own experiences of practice. My advice to you, I don't like that word, but is just to be really careful that it doesn't become too descriptive, because sometimes we love telling stories as nurses, and sometimes it can become a little bit descriptive when we start talking about our practice. But it might be something like within whoever's John's study, they described that access of Māori to health services in New Zealand was poor due to da 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 da, and you would say this is mirrored or something like this. I also see this within, this is true as from what I see in my community of practice, where access to well-child tamariki order services are this. Or you can actually critique the literature and say, however, you know, so John says that Māori have poor access to health services because of the poor cultural relevance of the service to their needs or something, let's just say. And then you could say, however, within my community of practice, what I observe is this. So it's not the same as what you've read in the literature. So you can either support and say, yes, this mirrors what I see in practice, or actually, this isn't what I see in practice. And sometimes that's the case, particularly in areas that haven't been researched significantly within New Zealand. You might say, well, they say this, but this isn't what I see in practice. And then having a little bit of data to support that is perfect. If you don't have data, that's okay, but it is really important to say, this is what I observe from my practice. This is from my practice experience, da 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 da, because you won't need to have literature to support that. But if you can link it to well child tamariki order literature around what you've provided, the care that you've provided, that's also really good. That's ideal.
Yeah, and another one that comes up talking about critical reflection is around housing. And so you may be doing housing as a health determinant, and your focus is on, for example, overcrowding. So that's we know that has lots of negative outcomes for tamariki. And so your critical reflection includes some description about your community. This is, I observe in my community that it's, you know, Dep 10 housing, and the literature indicates that this is whatever you've found out. So you can do that little bit of description but the critical reflection is against the literature, and you know what I see agrees with the literature, it concurs with the literature.
Yes. So or it doesn't. It doesn't.
Yeah, or it
doesn't concur with the literature.
Yeah, that's right. And I suppose just thinking about COVID, and we know that, for example, you know, Pacific Island rates for vaccination are really, really good. And so you might say that generally, you know, it's been reported in the literature that, you know, minorities and ethnicities may have a poorer vaccination rate, to do with access. But in my community, we have a great outreach service, so we have some really, you know, robust health services, and it's not the case in my caseload.
Excellent.
Whatever. So that kind of is, you know, description fantastic, but your critical analysis is a bit when you're saying, oh, gap, not gap, strength, whatever.
Awesome. Yeah, that's really useful. So it says here 300 words for each determinant, so you will need to keep your writing tight and summarize the main points. So there are lots of different writing techniques you can use, and one of the ones that I like to use within my academic writing is something called free writing, which is when you just type out everything you've been thinking based upon the literature, and then you'll notice when you do free writing, you'll write a lot of words, and then you go through and you find the key points and you tighten up your argument for each of the key points. So you've got lots that you want to cover, lots that the literature talks about, and then you choose the main points that you really want to tighten up and keep it really succinct. Oh, this bit got a bit descriptive, so that bit doesn't need to be in there. Or, oh, I've already made that point earlier, so that bit doesn't need to be in there. But you're going to need to keep this quite tight and summarizes that key action word really. So there might be this much written about the determinant of health. What's relevant to your community that you're going to focus on?
That's right. And I think, you know, you could easily do those 3 paragraphs when you describe your health determinant, and then you reflect on it with what the health outcomes are in your community. Well, that's 2 actually. That would be 2 long paragraphs. But so doing that kind of description and then that reflection about what you see in your community around that.
Great.
300 is not much, so you're going to, really hone in on just a couple of big points that you want to make.
And if you're struggling, because I struggle with academic writing, and if you're struggling with it, I find it really useful to read some of the literature and how they summarize, because man, they can, some of those academic writers in the journal articles, they can summarize, quite big themes, quite succinctly in little sentences. So if you're really struggling with getting it tight and concise, read how they do it. So it might be something like, within New Zealand, the determinants of health are not easily distributed, and you think, gosh, that's such a big thing to talk about, that for Māori, it's not equal to the way it is for New Zealand European, and for Pacific, it's different, and new migrants, it's different. But they've summarized that into one sentence, that the determinants of health are not evenly distributed across population groups within New Zealand. Tight. So read the articles, because they will give you really good clues. Don't copy what they say. We don't want plagiarism, but they'll give you really good clues about how to tighten and bring those big themes into tight, concise sentences. Every sentence has to count.
That is so right. And the last bit of this, or the third part, is it the third
just
assessment
part 3? There's an extra, it's interesting the way that it's been laid out. There's an extra part that critically discuss the role of the Well Child Tamariki Ora nurse in reducing the impact and disparity from these two determinants.
That's right. And that's your third, I know it is, we should have probably labelled them in the descriptor, but that's your third assessment task. And the important thing about this is that you are going to need to look at the well child literature. So as an example, you've chosen housing and the impacts of overcrowding. And so you're going to have to trawl through and see what is recommended in your role for best practice around that, around reducing the negative impacts of overcrowding. So you're going to be referencing what's in the Well Child Tamariki Ora Handbook and maybe some other Ministry of Health data. How do we do?
I want to show you something really cool that we've put together this year. The gorgeous Becky has actually done this for us. So have a look here. I'm just sharing my screen. Within the resources tab, we have this amazing section here called Foundational Well Child Tamariki Ora Literature, because it's been a bit of a gap. We've noticed that people aren't clear around what the Well Child Tamariki Ora literature is. So there's this really gorgeous Pahutakawa tree, and here you can click on the Well Child Tamariki Ora quality framework. This link, there's a blurb about what that is, and then there's a link of how you get to it. Next one, Practitioner Handbook. Again, a blurb about what's in it and a link to take you to it. So when we're saying using Well Child Tamariki Ora literature, these are the key documents that we are talking about.
Yeah, that's so true. And again, you can, so you can hold in your head again what you do in practice anyway. So thinking about housing, think, well, what did I do when I needs assessed Whanau, and they had really inadequate housing, and we decided that we needed to plan an intervention. So think about that, because that's what the critical analysis is of your role. So it's going to be often around a collaboration. First of all, it's going to be around your needs assessment, and it's maybe going to be around the intervention is going to be around that you collaborate with maybe a service in the community or another service in your team, or you work with the whānau to discover where they would like to go with addressing this issue. So it's going to be around, your practice is going to be around collaboration. This is a community, so it's not just about providing health education. It's quite often working in a wider scope. Yeah. And you may well indeed provide some health promotion or health education around ventilation in your home or something like that, but it's going to be not just that. It's going to be collaborating, if possible, with like a DHB Healthy Home Service, or linking into secondary care for a further assessment or something like that. And if you do a word search in the Well Child Tamariki Handbook, you'll probably find something comes up because we all know that's not particularly user-friendly in its content page. But if you do a word search, or something will come up around referral pathways and stuff.
Yeah.
Yeah.
Yeah, that's really useful. And I think that covers the first 2 bullet points of the supplementary sheet. That last one, consider the current interventions related to your determinants. Are they effective or not? So you might be talking about referrals to housing, and you might say, yes, I have the ability to write referrals to housing through I don't know, Housing New Zealand. I know it's not called that anymore. Or, the City Council housing team. However, I almost, in my practice experience, contact or reply from my referral is limited, and the ability to have families relocated within the same community has not yet occurred. So you're saying, actually, yeah, they have the service, but it's not doing anything to improve outcomes.
Yeah.
Or it might be, can you give us another example, Jess?
Actually, I'm just going to elaborate on that example, because in that
Perfect.
case, you've done that lovely bit of critical analysis. There is a referral pathway into housing, but actually they're totally overburdened. We don't have a good communication process, and so therefore the thing that's going to fall back on your nursing practice is that you're going to much more focus on some health education around ventilation or immunisation. If it's about overcrowding, that you're going to try and get everybody fully immunised in the household. So that critical reflection will be that actually collaborations to address this wider determinant of health are inadequate. So I really have to fall back in my nursing scope with health education, health promotion, try and build up health literacy. That's another great thing which kind of cascades all the way down all these topics, that you're working around health literacy when you're providing health education, and culture as well. So, yeah.
That services aren't perhaps culturally specific or appropriate to the
population.
population.
Or your population. Like maybe you've got a whole lot of young mums, and the literature says that actually they just loathe interfacing with most community or government services, and that so while you've really identified that this may be a very small population is greatly at risk from a poor determinant of health, then there are no services. And so again, your role may be around advocacy, working with a community group, that kind of thing, as well as providing this more individualised care.
Yeah.
But I just think, sorry, because I know we've got one more to go, and then probably about 5 minutes to go, but and underpinning all this, guys, is really understand what health promotion is. So health promotion is about addressing inequity. I know I've kind of assumed that when I'm thinking about it and talking about it, but health promotion is about population health, and population health is about that we all try and get the same outcomes, that when nobody's disadvantaged because of their determinants of health, or because of their culture or their language. So population health is about kind of a wider conversation. And that's what we're thinking about when we look at our community, really. Cool.
Fantastic. That's great. So again, this is only about 300 words, this section, so you're going to need to keep it tight. Pick 1 or 2 points that are relevant, it says in the supplementary sheet, and summarise those main points. And it gives you the literature, the Wild Child Tamariki literature. Not all of it, just some of it is there, but as I've just shown you, there is a wonderful resource on Moodle that will support you to support your discussion about our health promotion, our health education, and our role in advocacy.
That's right. And thinking about on the last shoot when we had Vivian, who linked us to the eCall resources.
Yes.
So again, you might have a population which that's really, really relevant for, and you'll find that probably linking into that as a resource for both this critical discussion and for part 3, when you're talking about a health determinant related to a disparity. So it's going to be related to a particularly identified population, is where you're going to have to do that little extra literature search around what is it about this population, whether it's around ethnicity or age or migration status or location. You're going to do a little extra literature search. Yeah, language, right. That sort of thing.
So it says here, it says here within the supplementary sheet, part 3, identify a health issue that impacts on Tamariki and Whanau for those at risk of disparity in the community where you work. So this is separate. So you've talked about broadly about the community, about from a population health perspective, describing determinants of health before here and critically analysing those determinants of health for populations at risk. Now we're going to talk about a health issue, which is the bit that people love to talk about, specific health issues that impact on the Tamariki and Whanau within your community of practice. So can you give us some examples of what those health issues might be, Jess?
Yes, and again, so reflect on your community and try and keep it real. What is the one that you notice that, you know, people are struggling with? Is it low immunisation rates? Well, actually, looking at the immunisation data recently put out by IMAC, have a look at it if you haven't, then all of us are struggling with immunisation rates at the moment. Or is it breastfeeding? Like you actually have a really low rate of breastfeeding in your caseload. You know that, you know, there's a lot of artificial feeding or mixed feeding. So reflect on what's going on in your community first.
Yeah,
and
SUDI would be another really good topic.
Yeah, that's right. Population really at risk of, so you know if you've got a high Māori population, and you know we absolutely know that as a population they're much more at risk of SUDI. Smoking rates, you've got a lot of smoking.
Yeah.
So just
it could be COVID. Imagine we could talk about COVID. You know, if you have high rates of COVID within your community of practice, that would be really interesting.
Yeah.
So what is most impacting the community of practice where you work? What is the health issue that is driving disparity within the population where you're practicing? So we've got 1,500 words here. So it's quite a big chunk of writing.
Katrina, you just talk a minute. I'm just going to get my little thing on the Ottawa, and because that'll help our discussion.
Cool, perfect.
It's all yours for 2 minutes.
Oh, I feel very lucky to be able to talk to you myself for 2 minutes. I hope that you're doing okay. I know that this is a lot. There's a lot packed into this, and sometimes when we try and tease things out for you to make it clearer, it can feel overwhelming with the amount that you cover. So I've got some advice for you. I hate giving advice, that sounds terrible, but I've got an idea for you. And some of you will have heard me say this before, that when I started in the Doctor of Health Science program, they challenged us by saying, think about where you do your best thinking and do more of that. So at this point, I just want to pause. And the way that I would approach this, and you don't have to because we're all different and I'm neurodivergent, so I do things in strange ways, but I would read through this, I would digest it, highlight some of those action words, and then I would do some thinking about it. I wouldn't write, I wouldn't make my plan, I would just think. So I might go through it, look at it, read it really carefully, read it through a couple of times, highlight those action words, and then I might go for a run. Because actually, when I'm running, I do really good thinking. And so I know that this can feel very big. Jess, I'm just describing, like sometimes our attempts at trying to make things clear can feel overwhelming. So when you approach it, I really encourage you just to read through it a couple of times, highlight those key words like we talked about, and then go and do something where you do your best thinking. Go for a walk, go to the beach and connect with nature. Do something that will allow you to limit the distractions, calm yourself, and just think, okay, what are they actually wanting me to do with this assignment? You know, because it's quite simple, but you need to be calm enough to be able to think through it. Okay, go for it.
And look, you know, because now we're on a slightly, but of course, very, very important, because of course, your brain function, I mean, you can't just bombard your brain all the time with, I've just got to nail this no matter how much I feel. It doesn't, your brain doesn't work that way. So again, if you're feeling overwhelmed, you need to, sometimes, I mean, there is a guy, Andrew Huberman, the Huberman Lab, and he's a neuroscientist who talks about if you're needing to focus, so like you find you're all over the show and actually you can't settle on a health determinant, you actually just can, there's techniques to help you focus. And one of them is putting a little sticky note on the top of your computer screen and just literally honing your vision into that spot for a couple of minutes. And that will actually help you to calm down and begin to narrow in your thinking focus. Or alternatively, if you're just like obsessed about one point, go out where you actually go outside into nature and you can look all around and you literally broaden your visual field. So sometimes just doing something differently will help your brain to get it jag off in a different way. And yeah, if you just feel like I hate this, I'm just over it and it's not working, yeah, so absolutely stop.
Yeah, there's a really cool
Right.
Māori proverb, and I can't remember it in te reo, but it basically means something along the lines of you can't think while you're sitting on your bottom. And I love that because often moving around and getting outside and do something where you do your best thinking, that will help you to make sense of what it is that we're asking of you.
That's right. Or if you're just really, really obsessingly worrying, if you can just get out and get a broader perspective and stop thinking for a minute or two, your brain will still be working, but that can often help you get back on track.
Cool. Awesome.
Yes.
So,
last one.
Briefly discuss why this is an important topic to explore in Wild Child Tamariki Ora practice. So these, when we're talking about this, just looping back to what we were saying before, this could be about smoking, breastfeeding, oral health status, immunisation, SUDI, obesity, COVID, you know, whatever it is that you've identified as a relevant health issue within your community of practice.
Yeah. And the supplementary sheet's really helpful here. You say what it is, you state the impacts on health. So, for example, breastfeeding. I mean, there's so much literature around the positive things around supporting breastfeeding. So you can link to that. And linking back into your community. Why have you chosen breastfeeding for your community? So that is going to feed onto the next assessment task, where you're going to unpick a little bit more about that disparity there. Yeah, so let's have a look at that one. Compare this is our second to last assessment task, guys. Okay, so nearly there.
Hang in there.
Yeah, so you've got your health issue. The next one is compare, that's the action word, your caseload and area or local data against national data and outcome targets for your chosen issue. And again, what we did in Shoot, the stuff Marianne did around the Wild Child indicators will be helpful for that. So you've probably already got a bit of a head start thinking about how you can compare. You know, we've got clear data on breastfeeding rates, we'll have clear data on smoking, we'll have clear data on some SUDI risks. So you can, you know, explore what that data is. Some of them won't be so clear, and one that's often chosen is oral health. So I think the indicators are around accessing, being enrolled in a dental service and accessing, or number of cavities at aged 4 or 5. So again, your reflection will be that this is a very important health determinant we know around, like, or health issue, sorry, around oral health. But again, your data match may be a little more difficult. So what you reflect on in your caseload may not be what is written in the quality indicators, for example. So you're going to have to do that little bit of analysis around what you can reflect on in your caseload.
Yeah, and interestingly, so within Wild Child Tamariki Ora practice, we don't report our postnatal depression data or our family violence screening data to the Ministry of Health. So it's really hard to, you can't go onto the quality indicators and say, oh yes, this is what they say about postnatal depression, positive postnatal depression screening, because it's not reported. So you might only be able to have access to national data. So studies that have looked specifically around postnatal depression, and there's some great studies, particularly there was a really good one, I think in like 2000 oh no, I'm not even going to say, but around the incidence of depression in Pacifica population groups. And that was a fascinating study because it was the first of its kind to really break down the data for different Pacifica groups. And the prevalence went from, you know, something like 12% to it was 30% prevalence of postnatal depression for Tongan mama. And so you might have to compare against national data because you don't have that local data necessarily, or you might have access to your local data from BI dashboard or whatever data collection tool that you use within your provider.
Yes, so just that reminder, whatever your reflection is, it's around your group that has got disparity. And of course, Whanau research has actually got some stuff, I'm thinking about it now, around some Pacific mamas experience of mental health postpartum and in the, you know, in the early parenting. So look for that ethnic specific data for your health issue that tells you why you're concerned for your population there.
Yeah.
Yeah.
Great. So it says here as well, if your caseload data is not readily available, you can do a self-audit. So you can have a look through, you know, a set of a period of time where you're looking at the sets of notes and you're looking at what the PHQ-3, the postnatal depression screening tool, what the answers have been over a certain period of time. And it's really useful for us as a reader to hear you say, I took an audit of the last, I don't know, 2 weeks, or it could be more, you know, depending on how much time you have. And this is what I observed, because it will tell us where your data has come from, and you won't necessarily need the evidence to support that if it's your own local data.
And of course, what you may find is, so you're doing a little bit of a self-audit around your PHQ-3 screening around PND or postnatal mood. So, and actually what you find when you do your audit is actually, God, you don't record it. Yeah. Even though you might know from your own practice that you do ask it, actually your actual data collection is not really up to it. So that is a really brilliant, valuable learning that we love you to write about, because it's not about what's right or wrong. It's about learning how you're doing, and maybe the objective data that you know is not there. And so that's a fantastic learning opportunity for you around, God, I know I ask it, but actually I don't record it. Or maybe it's I ask it, but there isn't anywhere for me to record it. Or
it could be that I ask it and I record it, but I don't do anything about it. You know, I've been referring these mama on. And it's really useful learning. And that's what this assignment about, is trying to improve practice. You know, trying to really think about your practice from taking a step back and looking a little bit more broadly about, okay, this is what is important for my community, rather than just being very focused on individual whānau. What are the big overarching determinants that impact? What are the major health issues that are an issue within my community of practice? And then thinking, okay, how do I prioritize my care so that those issues are being addressed at a population level?
That's right. And the other one, so also around there, is around smoking. So again, maybe you do your caseload analysis and you realise that actually you don't really understand the definitions, or the definitions are not clear. And I know that for me that's the case. I'm often like, where do I get this definition about within 3 days has your baby been smoke exposed? So you might just have to do a little bit of drilling back into what kind of data you're collecting and where there is a gap there. And that's what you talk about. That is just perfect to talk about, you know, as a comment, as part of your analysis there. Right. So should we box onto the last one, Katrina?
Yes. This is Jess's passion subject, so that's perfect. We're going to critically analyse the health issue to identify gaps. So my health issue, let's say my health issue was SUDI. I'm going to identify gaps that around that topic, either using the 5 action areas of the Ottawa Charter or the 5 strategic themes of the New Zealand Health Strategy. We're going to explore the gaps and the opportunities.
That's right. So let's take SUDI as our example, and keeping in the back of our minds that this gap analysis is around population health. So we're doing it from a health promotion, what needs to be improved for this population. So while the individual is kind of embedded in that, this is about health promotion. And what are we doing currently that is a gap for my population? So with SUDI, I'm just going to take the Ottawa because that's the one I know the best, but you can also use the New Zealand Health Strategy if you want. So the Ottawa Charter's got 5 action areas, and you guys are going to have to read it and be able to define it just briefly when you go through each of these topics. So the first one is building healthy public policy. Remember, you're going to stick to your topic. So your health topic is SUDI, and you're going to Google and reflect on is there any healthy public policy about any national laws about SUDI, about safe sleep? Well, actually, I can't think of any offhand, right? We don't have a law that says you can't bed share, even though we know that's a huge risk for your baby. But so that's going to inform your discussion. But we know we've got public policy, and we know we've got national groups like Ha'apai, the National Sudi Coordination Centre. So that's going to be a 1 or 2. I think we've given how much per
200
topic?
words per section.
Yeah. So it's going to be 2 paragraphs per section. So you're going to do a little bit about the major things that you find. So there might be a paragraph about, well, actually there aren't any national laws that pertain to SUDI, but we do have national policy, and you could do a paragraph around maybe SUDI, the SUDI prevention people, or whatever you discover. And smoking, of course, is a different one. We've got tons of laws around smoking. So again, you can just summarise that.
Correct.
Okay, creating supportive environments. And again, that's just so you make sure you know what that is from the literature, and that you've got a little definition that can start your discussion off. So what kind of supportive environments would we say we had for breastfeeding? SUDI, sorry, Katrina.
The SUDI, supportive environments. So it would be about, are we talking about individual environment, or are we talking about population environment here?
Yeah, so it's the ones like supportive environments would be around hospitals who have a safe sleep policy. So it's when you go somewhere that the negative health outcomes for this health issue are not supported. They have a proactive stance to stop that happening.
Right.
So it's in the wider thing. So yeah, hospitals would be a good example of that one there.
Yeah.
And let's see, can I think of any more offhand? You've got your hospital. You'll have hospital kind of policies. Hard push to think of another kind of a wider one, but again,
I am for SUDI, but for smoking there would be a lot more smoking related policies. So smoke-free environments, in playgrounds, the smoke-free cars now.
Workplaces.
Lots of smoke-free workplaces and restaurants and bars and things like that. So lots of areas where children would historically have been exposed to cigarette smoke. There has been policy put in place to reduce that or limit that now. Yeah,
and I guess the third thing about writing about these sections is just like you're going to identify the gaps briefly as well. So the one about building healthy public policy, there's a gap in around law. Well, that's probably not something we can do in our role as well, child nurses, so much, except maybe advocate or collect really great data or something like that. But so each of these sections, you're going to identify gaps. So with SUDI, you're going to reflect a little bit more and think that this is a gap here around a supportive environment. Strengthening community action is one which is a great little one to do, because especially as a well child nurse, is because it's when you're using it says existing human and material resources to increase self-help support and participation. So what is it in your community that is supportive of preventing SUDI? Maybe you've got a weaving group.
Yeah.
Maybe you've got a special antenatal group which is focused on supporting whanau to reduce their SUDI risk. So reflect on what's happening in your community and any gaps.
We had a great service when we were both practicing within Newtown, where St Vincent de Paul's had a free, I think it was free, bassinet hire.
That's right, yeah.
And so within the community, if we identified a whānau who was co-sleeping and they were pretty keen to have the baby in their own sleep space, but they couldn't afford or didn't have access to safe sleep space, we would contact St Vincent de Paul and they would provide a free bassinet for hire until they no longer required it. And then Jess started, and I continued an initiative in the community as well, that once they outgrew the bassinet, they then were able to access a free cot that they could keep. And we ran local fundraising and things like that to be able to fund those initiatives, but they were local initiatives that probably had quite a significant impact on SUDI rates, because everybody who wanted to have a safe sleep space was able to.
Yeah, that's right. So I think the key about that one is, what is in your what is in your environment, human resources and material resources, that you can, and there'll be gaps in there for sure. There
And
may not be people.
I was just thinking within some, sorry, Jess. I was just thinking within some of the Tamariki Ora providers and Pacifica providers, they will have a designated safe sleep navigator or kaiawhina who can go and spend time with whānau, supporting them to settle pepe to sleep in their own sleep space. They may have access to wahakura, they may have access to pepe pods, so there are lots of resources available because it's one of the priorities of the Ministry of Health to reduce SUDI rates. So thus, there is resource that is invested into local community action to be able to reduce those SUDI rates.
That's true. So that can, keep it real about what's going on in your community. Developing personal skills, and again, this is a really good one with us and our well child, that we can often identify gaps that we can work on. So it's one that you can really realise and that you can work on in your final assignment as well. So developing personal skills around SUDI. What do we have? We have our needs assessment with linking to others, community groups or kaiawhina, or our knowledge within the well child scope. It's all about health literacy, that kind of thing. But is there a gap for your population around an appropriate person or an appropriate resource, around a language maybe? That's the kind of gap you may identify in building personal capacity up, often around language or group or culture as well.
Yeah, or access, or absolutely.
Yeah, that's right.
Right.
The other one there is that, of course, in this modern age, we have lots and lots of apps. So apps can be a real strength around increasing health literacy and doing some health education. So you may have a Google about your kind of apps, and there'll definitely be some SUDI apps, and there's lots of smoking apps and there's breastfeeding apps and all that kind of stuff. So that can be a real positive, but maybe there isn't one for your community.
Yeah.
Or maybe the barrier around cost or something like that.
Yeah.
So I think a little bit outside the box here as well. What other kind of resources have you got? 0800 numbers, for example, as well. All those things that increase health literacy, really. So there's bound to be a gap in there, absolutely bound to be a gap that you and your well child scope could address.
Right.
Yeah. The last one, reorientate healthcare, and that's got the preventative kind of emphasis again. So hopefully all these topics, and we've explored it, for SUDI and a little bit for the others, and they all do have a preventative aspect, and it's often about collaboration. So have you got a strong collaboration in your area for your topic, or is it a gap? Is communication fragmented and difficult?
Yeah, and it might be something like, I've heard that the local marae does weaving wānanga for wahakura, but I don't know the pathway to, I don't have a relationship with them, and I don't know the pathway to refer whānau who are interested in weaving their own wahakura. So, it's about, the importance of relationship in whanaungatanga and working with iwi-based organisations. But that could be an example. Or, the pepe pods, some whānau seem to have access to pepe pods through their midwives and other whānau don't. And I'm not sure what the referral pathway is for pepe pods. So it might be about looking into that and strengthening those referral pathways so that the barrier of access to pepe pod can be reduced for your community of practice.
That's right, and it's often all about the resourcing. So again, you're going to really tie it back to maybe there's no data that really just describes the disparity for your population. So that can be a gap. That maybe some kind of advocacy around that as well. But so often reorientating requires resources, and I don't have them current ones offhand, but I know if you look at vote health, i.e. all the money from the government that goes into health, by far and away the majority goes into secondary care. I want to say something horrendous like 2% goes into preventative primary health care. I think it's more than that now, but it's really, really significantly small. So that actual reorientating health services, which is what health promotion is all about, is still really being eroded constantly, really.
Yeah.
So somewhere around those vote health, I must have a look for next time.
Mm.
And
So they've made it really supportive for you with the supplementary sheet here. There is a direct link to the Ottawa Charter document and a direct link to the New Zealand Health Strategy, so that you can have a look and see, because sometimes it's around the topic that you've chosen that you think there'll be a better fit. Oh, this one fits really well with the action points of the Ottawa Charter, or, oh, actually, I think this fits better with the strategic themes of the New Zealand Health Strategy. So have a look at both and see what you think is the best fit.
Yeah. And for that last one, which is often the reorientating health services for the Ottawa, and there'll be a relevant a comparison in the health strategy. Often the reorientation is around equity and around the Treaty of Waitangi for Māori, and so you're really going to some of that literature is going to come into your discussion. That this is what we're needing to do. This is what, or the Y2575, findings that we're still really so many inequities and health outcomes that's going to be your reflection about why we need to have this preventative emphasis, and that we are not there yet.
Yeah, that's really useful. Thank you. And then finally, the conclusion, 200 words to pull it all together.
Yes. So conclusion, and again, you're gonna, if you've worked through this process, which you will have done, and thought, oh my Lord, I've learned so much, then it's just it's a little summary, it's a little reflective couple of statements about, have you met the purpose? What have you learned about what have you learned in your analysis of your community and your health issues? So it's a really brief, 1 or 2 paragraphs about what you've learned about your community, using the language of the assessment tasks and the purpose often, so that you can, describe briefly say, I know my community is negatively impacted by the determinative health of housing, and we have a real health issue, lots of negative health outcomes around that, and also around, my breastfeeding in the community is way below the national average, for example. So it's that kind of reflection about what you've learned. You don't bring in any more new info. You don't need to put in any citations, and it's that reflection that pulls it all together about what you've learned over during the assignment, really.
Yeah. And as I've said earlier, I really encourage you, if you're finding it hard to be succinct in your conclusion, to have a look at some of the academic journal articles that you've used and look at how they pull it all together with the conclusion. It's like a summary of your learning. So it just has a few really key, you can't cover everything, but a few of the really key points of learning that you have undertaken, I suppose, within this assignment.
Yeah, what you've learned about your community, and we have some great ones that come up. People really do big learning for this assignment, just around the structure of their community and their strengths and the risks that are related to your scope as a wild child nurse and what you can do, really. So
thank you so much. If you're still with us, I've just seen we've just ticked over 1 hour 30. So I can't believe that it has taken this long to talk through the assignment, but it is complex, but you just need to keep it tight. And I really encourage you to go back to the beginning of this recording and think about the structuring and the planning for this assignment, because if you structure and plan it correctly, you really can't go off track and get it wrong.
No. Yeah, it's a big assignment, so and it does. When we were starting to, we thought, oh look, we'll try for 30 minutes, 45 minutes, just as a chat, but there is a lot in it, so stay calm and you work your way through it, and you'll get a lot out of it about your own community, and working with that health promotion lens.
Yeah, fantastic.
Look forward to reading them.
Yeah, absolutely. And remember, we are here. If you have any questions or concerns, please feel free to get in touch at the Wellchild Tamariki Order educators email, or you're welcome to give us a call as well. But yeah, like I said, approach it, look at it, read it, digest it, and then go and do whatever it is that you do where you do your best thinking, and do lots of thinking about this assignment before you jump in and start writing and researching.
2 Zoom sessions next week. So there's one, looking on the Moodle calendar, there's one next Tuesday afternoon at, is it 3? I think it's between 3 and 4. Or it might, yeah. And there's one on good old Thursday evening. So you've got those Zoom sessions coming up as well.
Yeah. So it'll be great if you've had a good read through and a bit of a think first before you come to those Zoom sessions, because that's when it will be the most beneficial for you.
Yeah.
Fantastic.
Thank you very much for listening. Thank you, Katrina.
My pleasure. Thanks, Jess. And yeah, get in touch if you have any questions or concerns. Otherwise, we'll see you at the Zoom sessions. Ka kite.
Yeah. See ya. Feel Zara done, hopefully.